Hi, I'm Dr. JoAnn Hirth. I'm one of the medical oncologists here at Allegiance Health. I trained at the University of Michigan and then joined the group here in Jackson in 1997. Chemotherapy are medicines that are taken into the body. Oftentimes they are given through a vein or called intravenous. Sometimes they are a pill and are simply taken by mouth at home, but they all work in some way to get towards the cancer cell and to stop that cell from growing and dividing. Sometimes they also limit the environment around the growing cancer so that the cancer no longer can take hold or move on to a new spot. So they all work in a lot of different ways, and it depends on exactly what type of treatment and what kind of cancer you have, but essentially they all work to stop the growth of the cancer. Chemotherapy can work on a lot of different cancers, but it doesn't always work on every type of cancer, and some are more sensitive to chemo than others. It's important when you have a cancer to understand and talk precisely about your situation with your provider, because many cancers are treated very differently. So some people need chemotherapy to help control their disease and improve pain and other symptoms. Other people may have no symptoms but are taking chemotherapy to prevent that cancer from coming back. Many people want to know why they need chemotherapy or if they could have a different treatment such as surgery or radiation. And many cancers need more than one type of treatment to give the person the best health outcome possible. And oftentimes a person would need a surgery, potentially be recommended to get some radiation, and very often there is some sort of chemotherapy that is recommended as well. So there can be instances where chemotherapy alone is used, but more commonly cancers are treated with some sort of surgery or biopsy, and then chemotherapy would be added to try to keep the person healthy. The treatment length on chemotherapy is another good question to ask your provider, and there are some treatments that are short, a matter of weeks. There are other treatments that go on indefinitely, again, depending on what type of cancer you have and what stage you are diagnosed. So some treatments are given as a preventive in a person, for instance, who's had an early stage cancer. They may have had a surgery or radiation, and the goal of the chemotherapy is to keep the cancer from coming back and to give you assurance that you have removed all of the cancer and will go on living a full life. Other people may have a situation where their cancer is advanced at diagnosis, and the chemotherapy will help control that illness and hopefully make it better and improve the patient's quality of life while they're on the treatment. However, the cancer is a chronic condition that needs chronic active care, and your chemotherapy may go on for quite some time as long as it is helping and as long as you're experiencing no severe side effects. So the treatment length is very different for all of these different individuals. And again, your provider will be able to walk you through how long to expect your treatment. Some treatments take longer than others, but in general, a person is in the treatment room for anywhere from a half an hour to several hours. Some patients do need to come daily for several days in a row. Other patients may just be there every 2 or 3 weeks. Chemotherapy worries people because of side effects, and again, there are many different chemotherapies and they all have different side effects. But we can usually predict for a patient what the common side effects are going to be and how you may feel during treatment. Most chemotherapies do cause some degree of being tired, but you're not expected to be so tired that you won't be able to keep up with some normal activities and enjoy your life at home. Some chemotherapy does make you lose your hair, and that is something that a lot of chemotherapies can cause. However, not everyone loses their hair, and some medicines do not at all affect your hair. Normally, if there is hair loss, your hair does grow back when you are done with treatment. And we have reputable sources where people can have wigs or hair pieces to help if the medicine does make you lose your hair. The other side effects that we worry about are nausea or diarrhea. Some medicines can cause that. Again, not all chemotherapy will cause that. And your provider will let you know if you're on a medication that may cause one of those side effects. I think it's also a blessing in the era of medicine we are at today that we have much better medications to prevent any nausea or diarrhea for patients who are on chemotherapy. And so we do a much better job controlling those symptoms nowadays than we did several decades ago. Another thing with chemotherapy that has also influenced other aspects of medicine is our advancing technology and our use of improved ways of giving the chemotherapy. Many patients, as I said, do have their medications given through a vein, and a lot of chemotherapy patients have a device called a port that is a minor surgical procedure that allows the medicine to be given through a good, secure vein that does not need to be started anew every time. So there is a stable IV site that a nurse can access that is placed underneath the patient's skin, oftentimes up on the chest. And there isn't a need to poke and start new IVs in the patient's arm every time they need a treatment. So it offers a much more convenient way for the patient and the staff to be able to administer IV chemotherapy. Another advance is in the way the chemotherapy is mixed by the pharmacy. Doses of chemotherapy don't come prepackaged. They need to be dosed according to that individual patient and that individual patient's characteristics. So they are mixed on site on that day for that patient. We have a robot that allows us to store our medications with computer controls so that the precise medication is mixed and administered, and it has markedly reduced any human error. The other advance is in the side effect arena. We do have many more drugs available to us that are given before the chemotherapy that do a much better job of preventing any nausea or diarrhea. Also, comfort is of importance, so we do have nice, comfortable, what we call infusion chairs, but essentially they are somewhat like a lazy boy chair where a person could decide whether they want to be sitting up or lying down, and we try to keep you as comfortable as possible. The other very exciting thing to us as providers is just all of the new medications that are available to us that even didn't exist when I was in my training back in the mid-1990s. And a lot of those medicines are much more specific for the individual's cancer, so they tend to work better and they tend to have less side effects than older medications did. And a lot more are now oral and able to be taken as a pill, which is certainly simpler for patients and our staff. Another thing to bring up is the effectiveness and outcomes of the chemotherapy, and how do we know that they're working? We do need to monitor patients on treatment to know whether we are being effective or not. So oftentimes there are CAT scans or other means of measuring the cancer that are done in the middle of the treatments to assure that we are on the right path and that our patient is being well cared for. And certainly when they come back and we have a CAT scan that shows their cancer is doing much better, we all feel very very good, and it's a wonderful day to go on and go forward.